Hi, and welcome to the Senior Minute. Subscribe to our videos for all the latest information regarding senior health, home care instruction, and exercise that fits your lifestyle. So today we're going to have a casual discussion regarding home care. So for the purposes of today, when I talk about home care, we're going to talk about skilled home care. Skilled home care includes registered nursing, physical therapy, occupational therapy, speech therapy, and a medical social worker. A home health aide is also part of the team, but they're not considered to be in the skilled care category. Now that being said, I want to put a disclaimer on those terms because some of the most skilled, wonderful people that I have met that have been helping in the home do not have a degree or any letters behind their name. They're being put in a different category for this video because that particular type of care that's paid hourly or that lives in the home is not being paid for under Medicare A service. So the Medicare A homebound home care service for the truly homebound includes the list of people that I just talked about, the nurse, the therapist, PT, OT, speech, the following. So anyway, you get the idea. So what's going to happen generally is that you'll be in discussion with your doctor. They may recommend home care for you. The doctor may not know much about home care and have met somebody from a home care company that talks about the service. We do a lot of fall prevention, balance education from the therapy standpoint. From the nursing standpoint, does a lot of disease education, medication reconciliation. These are big fancy terms. Really, the home care team is there to make sure that you're safe in your home, that you know about your health, if you're diabetic, if you have neuropathy, if you've had a stroke, if you have congestive heart failure. I could go on and on and on about the things that I see people struggling with in their home. And it's often difficult for you as a patient or for you as a caregiver, to manage these things on your own. And so the home care team will come in as per recommended by the doctor, or sometimes you're being discharged from a hospitalization. Maybe you've had a hip replacement or whatever it is, and you'll hear that the team at the hospital is going to recommend home care for you. Sometimes it's recommended from the nursing home. So it can come from anywhere, or maybe you think that you need home care, and then you can go in and talk to your doctor and ask the doctor for home care, and realize that it's your right to have any home care team and company that you want. So whether or not your doctor has a relationship with a specific entity, if there is somebody that you want to see, then you need to make sure that you ask for that company because they can write you a prescription to go wherever it is that you want to go. And you also should realize that you can pull up on the Medicare site. I think it's called You Compare Health. I'll see if I can find a link for that and embed it in this video. But you can go and you can see the outcomes for all the different home care companies nationwide. And you can make your own decision from that point as to who you want to see. Talk to a friend, but I recommend using that site because it's accurate, and companies are now being held to a standard of showing what their outcomes are, and that's only for your benefit. So let's talk about the team and the process and everything that happens, so you kind of know what to expect when the doctor recommends home for you.